So after months of waiting for today's announcement from the governor, there is controversy surrounding the recommendation to criminalize public drug use.
Yeah, we sent Elise Haas to that summit to hear from the notable attendees who were there. Elise?
So the Portland Central City Task Force was made up of 50 people and upwards of 120 if you include the additional 5 issue committees. They worked for the last 4 months to develop these recommendations that were released today.
Times of crisis can lead to a desire for drastic change.
A clear message: change is coming, as Governor Tina Kotek unveiled the list of recommendations to revitalize Portland.
Were there some tension points around the edges? Absolutely. But more importantly, there was incredible consensus, collaboration, and a level of engagement between city, county, state government, the business community, service providers.
Dr. Andy Mendenhall is the CEO of Central City Concern. He's board certified in addiction medicine and served on the governor's task force.
Central City Concern supports the ban on public use of drugs. We recognize that this is a potentially contentious issue, but we also believe that this is a mechanism to create some accountability, drive the community in a direction towards safety, and help folks that are struggling get access to the services that they need.
He acknowledges the limited access to addiction services right now, but he says that the governor's plan simultaneously commits to prioritizing rapid expansion of treatment and shelter. The amount of public fentanyl use, he says, has had an outsized impact on public safety and even people's willingness to come to work. He believes a ban balances those serious concerns. Coin 6 brought in another task force member to better understand where the downtown businesses are coming from.
We found that public safety really underlied the current of every single committee. So that issue came up over and over again throughout the process.
Meanwhile, there are some advocacy groups that are opposed to criminalizing public drug use. Instead of criminalization, the executive director of the ACLU suggests the state focus on adding addiction services and housing.
And what we've seen is over the 50 years of the war on drugs, which used a criminalization strategy, jails, prisons, and police, that only made things worse. Criminalization makes it more expensive and more difficult to solve homelessness and drug addiction.
Meanwhile, another addiction advocacy group, the Health Justice Recovery Alliance, supports the task force's recommendations to expand access to treatment, but thinks that it all gets put at odds by bringing police back into the picture.
You don't arrest people for being in the middle of a public health crisis. People are dying. So what this is going to do is it's going to drive people back into the shadows, and we're going to lose more people in our community. That's just the reality of it. There are other solutions that they could have chosen that would have been more courageous politically.
As an alternative to prevent public drug use, Tara Hurst recommends overdose prevention sites and the rapid expansion of detox centers. Meanwhile, there are other public safety advocacy groups that came out today saying that the ban on public drug use doesn't go far enough. So there are opinions on all ends of the spectrum. The task force 10-point plan is expected to roll out in the next few months. But to be clear, the recommendation to ban public drug use and to recriminalize drug distribution would require legislative action in February.